Razor-sharp jawlines are having a serious moment in pop culture. Board-certified plastic surgeon Dr. Deepak Dugar joins me to perform a 5-minute lower facelift on his patient, Mia. Dr. Dugar, thanks for joining me.
Oh, my pleasure. Thank you so much for having us. Miss Mia here. Beautiful, beautiful young lady. We've just done her left side of her face, showing how we were contouring this to give her that youthful contour that she had when she was younger. However, on this right side, we have not treated yet. She still has that dip. It's the dip in front of the jowl. This is called the pre-jowl sulcus, often ignored by a lot of doctors when they're treating the lower face. And so what I love to use is a product called Restylane Defyne. It defines the jawline really nicely.
Okay.
And it allows me to sculpt it to that youthful contour again.
So the idea is, your technique is to fill some of that area with the Restylane, and that will give it kind of greater fullness?
Exactly right. Because as we age, we lose some of the baby fat, especially in these areas. And then the muscle also is very prone to gravity. And so with that gravity problem that we have, that pull effect, we have to do something to treat it to give a little bit of a lift. And what I do is I go deep to the muscles, and I'm on the bone, sculpting along the mandible. And by sculpting deep, I'm able to pull the lift of the muscle up to give her that definition that she's lacking by aging in natural gravity pull.
I see. So you're injecting under the muscle, and it occupies space under the muscle, which actually lifts it up to give it more fullness, correct?
That is absolutely right.
Is there anesthesia, local anesthesia? How do you anesthetize her?
We have actual anesthetic in the product itself. So the Restylane product has anesthetic in it, which is amazing because it gives that immediate patient comfort without having to take time to numb the patient. So this becomes literally a 5-minute procedure.
And how long will the results stay after the procedure is over?
So for someone like her, I would recommend this be done once a year on average, because this is something that you can contour, but you can't get a permanent lift unless you truly pick the entire musculature up, which would require a facelift. But she's not there yet. Someone like her is so young and has such pretty anatomy. We don't want to do something drastic like surgical. We just want to give it a little bit of a lift. So we're all done. And before we show Mia, look to the camera, Miss Mia, and we're going to show how this side and now this side has been lifted. And we've taken away that pre-jowl sulcus by filling it with a little bit of filler to give it more contour and definition.
Wow. You can see, I mean, it's just you did it while we were in this segment, 5 minutes or less.
5 minutes or less.
And Mia, what do you think?
Fantastic. Thank you so much. Wow.
It just gives a little bit more of that definition, which is what we were looking for.
Exactly.
You know what I want to see, because it's so impressive, I want to see the before and now her after, which looks so different in just 5 minutes. I wanted to ask you, what happens to the Restylane? Is it absorbed? Where does it go? Why do you need it, another year from now?
So what we do with Restylane, it's made of hyaluronic acid. Hyaluronic acid fillers are fillers that will actually be absorbed by the body. So the body itself will absorb the fillers, and the body will take it away with its natural hyaluronidase enzyme that we all have. So by restoring the natural contour with natural hyaluronic acid, your body continues to metabolize it. So you never have to worry about permanent side effects, nodules, things like that.
Sure. And Dr. Dugar, you say there's one caveat that prospective patients should look out for, because some people are doing it wrong, doing this procedure wrong. What is that?
When you over-inject into the actual musculature, this depressor anguli muscle, that is where you can actually get a heavier pull, and then this muscle can actually look deeper and thicker sometimes. And I think that's a lot of novice injectors will inject too much in the actual muscle belly, and that's where it gets heavier afterwards instead of becoming softer.
You got to inject the right amount, so you got to go to a physician who does it often and has the credentials. So Dr. Dugar and Mia, thanks for joining us. You look great.
Thank you for having us. We're such an honor. Thank you.
Okay. There's more after the break.